Firstly, before we get started, I do want to let everybody know that this program tonight was sponsored by Bristol Myers Squibb and TG Therapeutics, and I'm virtually thanking them for doing what they were doing. My name is Stuart Schlossman, and I'm president and founder of MS Views and News. For those that don't know me, I also have multiple sclerosis, and that was a long journey that we don't have to get into tonight. So tonight's program is about physical therapy, occupational therapy, other therapy, wellness therapy, and you're going to see Dr. Thrower speak for about 30 minutes, all right? And then he and I are going to come back online after the video plays, and we'll be here to take your questions, all right? So just know that you are watching a pre-recorded video. I'm going to let that start in a quick moment. Dr. Thrower is going to go dark. I'm going to go dark. And then when the video ends, we're going to come back online and we'll be here to take your questions. All right. So Dr. Thrower, let's get started. Okay. And then we'll get introduced later. All right.
Good evening, everybody. My name is Stuart Schlossman. Thank you for being with us. Tonight is part 3 of our Learning More About MS Care series. And tonight we're going to have Dr. Ben Thrower speak about physical therapy, occupational therapy, speech therapy, and many other therapies. So you're going to enjoy listening to him tonight. I want to let you know that tonight's program is sponsored by Bristol Myers Squibb, who makes Zeposia, and by TG Therapeutics, who has a medication called Briumvi. Let's let Dr. Thrower finish this program with you.
Good evening, and thank you for joining us. My name is Ben Thrower. I'm a neurologist. I'm the medical director of the Andrew C. Carlos MS Institute at Shepherd Center in Atlanta, Georgia. The series that we're working on right now is trying to take you behind the scenes at a comprehensive MS center. We're looking at different components of an MS center that make it comprehensive. In tonight's series, we're going to talk about various forms of therapy. We have physical therapy, we have occupational therapy, we have speech-language pathology. What we'd like to do is go through what each of those types of therapy might offer to a person with MS, and then we're going to sort of shift gears and talk about maybe some more exotic forms of therapy, maybe some things that you've not heard of. One of the big questions is, what is the goal of therapy? It doesn't matter which of these therapists we're talking about. Really, the goals could be 2 things. We could look at trying to restore function. That might be improving your walking, improving your dexterity, or your activities of daily living. One of the other goals of therapy would be to actually adapt. If we can't restore the function, what if we could just help you learn to work around it and live with it? So we're going to cover all of those different bases. As we get into these different forms of therapy, one of the ideas I wanted to throw out to you is, where do you get that therapy? Physical therapists, occupational therapists, speech-language pathologists all have different areas of interest. There are therapists who really focus on multiple sclerosis. There are therapists who might focus more on, say, orthopedic issues or sports issues. Obviously, if we're working with multiple sclerosis, we would like to work with therapists who have some familiarity with multiple sclerosis. There are really 3 different settings where you could receive various forms of therapy. You could come to therapists that are based at a comprehensive MS center, like the one that we're in right now. To me, this would be the ideal setting because you could maybe combine those visits with provider visits, with infusions, with MRIs. So we try to get as much done in a short period of time as possible. Another setting that we could look at would be a freestanding clinic. So we're going to give you a prescription. Maybe you live too far to come in here. You're going to go to some facility that's closer to home for you and get therapy there. So the third way or place that you could get your therapy would be at home. The advantage of home therapy is the therapists are coming to you. You don't have to worry about transportation. It's tremendously convenient. One of the other advantages of home therapy is that therapist gets to see your environment. They could look at sort of maybe how you transfer to bed or to the toilet. So there are some advantages. There are also some limitations. When you look around this room, you see all of the toys that a therapist might like to work with. Obviously, they can't bring all of these things to your home. So there are limitations in what they can do in your home. I would say my bias is my least favorite way of prescribing therapy for a person with MS would be the home-based therapy. But in some situations, it's the best we can get, and we have to sort of work with that. So let's talk about the different types of therapists. So let's start with physical therapists. So physical therapists wear, like all of the therapists, a lot of different hats in the MS world. I would say the most common reason that we're referring someone to a physical therapist in the MS world would be for walking issues. So maybe you're having balance trouble. Maybe you have a foot drop, and we're going to send you to the therapist to work with that. One of my favorite topics in multiple sclerosis is walking issues. And I think the two most common things that we see that interfere with walking in MS would be weakness in the ankle dorsiflexors or foot drops, so your ability to raise your toes up off the ground is limited. In that foot drop, if that was the only thing that you were dealing with, you would compensate for that by bringing your knee up higher or using your hip flexors. In most people with MS, that's not possible. So if the ankle dorsiflexors are weak, chances are your hip flexors are weak also. So what people are going to do to compensate is they're going to circumduct their leg. They swing the leg out and about. Some people are not even aware they're doing this. But if you think you're dealing with foot drop and you're having a day when you're a little tireder, have someone watch you walk from behind. And what they'll probably describe is that on that weaker leg, you're swinging it out and around. What's the problem with doing that? It's not a normal way of walking. It's very tiring. You're putting stress on your knee, your hip, your lower back. So we love to get people into physical therapy with this situation. What are the physical therapists going to do with that? They might prescribe an ankle-foot orthotic. These come in a lot of different versions. For some people, they're completely appropriate. Other people don't care for them very much. They may not fit in the shoe you want it to fit in. Maybe you don't want it to be visible. You're wearing shorts, you're wearing a dress. So there are other alternatives. Some of the other alternatives are things that basically electrically stimulate the nerve and basically rewire your leg. So there are currently 3 devices out there that we think about most commonly. There's the Bioness device, there's the Walk Aid, and then the most recent development is the neural sleeve from Psionics. With any of these devices, it's really crucial that you get in with a physical therapist who knows about these devices to let them see if it works. I can sit in the exam room as a neurologist and think you might be the perfect candidate for this, but there might be some limitation that the physical therapist is going to pick up on. And because these are expensive pieces of equipment, we don't want an insurance company or you or somebody else to pay for that expensive device if it's really not going to be something that works for you. I would say the one that we've worked with the most and had the most success with is the Bioness device. We are excited about the neural sleeve. The challenge we've had with the neural sleeve is ideally we would like to have a trial unit. We want you to be able to put this device on, try it, see if it works for you. With the Bioness device that goes right around the knee, stimulates your perineal nerve, that kind of comes in small, medium, and large. So we can find a trial unit that's going to work for you to let you test that out in the short run. The neural sleeve is actually custom fit to your leg. So it's more difficult for us to have one of those just sitting around because the small, medium, large doesn't really apply. It's custom made to your leg. So we're working that out right now, like a lot of rehabilitation facilities are, on how we're going to do these trial units to see if it actually does what you want it to do. Other things that physical therapists work with in walking are things like balance issues. One of the most common causes of challenges with balance would be loss of proprioception. Proprioception is the ability to feel changes in position. If you can't feel changes in position, you're going to walk like you've had a drink too many. You're going to have your feet wider apart. You're going to know where the walls are, where your significant other is, where the furniture is at. So one of the things that physical therapists will do is work with you on core strengthening and other compensatory mechanisms to help you kind of work within those balance changes. One of the pieces of equipment that you'll see behind me here is a vibration plate. And vibration plates are something that you stand on, and it does exactly what the name says. It vibrates or oscillates at this incredibly fast rate. What studies have shown is that just simply standing on that vibration plate, because your body is having to adapt to those little changes in position, can actually help with your core strength and help with your balance. One of the other things that vibration plates are used for is to actually help with osteoporosis or osteopenia, bone thinning. What studies have shown is that you can actually help improve bone density through using one of these devices. Physical therapists work with a lot of different, again, adaptive equipment. They're going to maybe see if a cane is appropriate for you, if a rolling walker is appropriate. One of the situations that scares me a little bit in some of our folks with MS is if they're having walking issues and they just pop into the store and they buy a rolling walker or they buy a cane and have no instruction in how to use that. That may not be the most appropriate piece of equipment. It may be not appropriately sized for you. One of the worst things to do is to get a poorly fitted piece of equipment. For instance, with a cane, if it's too short and now you're tilted over to one side, you could actually put yourself at more risk for falling by using a piece of equipment that's not appropriate. When you go to a physical therapist, if you have equipment that you're using, make sure you bring that with you so that the therapist can evaluate it, make sure it's still in good working condition, make sure it's actually appropriate for you. A specialized form of physical therapy in terms of equipment would be a seating clinic. So in a seating clinic, this is someone who needs either a manual wheelchair, some sort of power mobility, say a scooter, a power wheelchair, and we're going to refer that person to a seating clinic that's actually going to measure you, make sure you get the right equipment, and is also going to be your advocate in working with your insurance company. So a seating clinic is not selling you a piece of equipment. They're making sure you get the right piece of equipment and working with that vendor to make sure all of this happens appropriately. Power mobility is a very expensive endeavor. We want to make sure that you get the right piece of equipment because the usual rule is whatever power mobility you get, whether it's scooter or power chair, you're probably gonna have to live with that for 5 years before insurance would consider something new. There are some exceptions to that rule, but that's the general thing that we think about. When we think about power mobility, it's not just, is this what fits you? Is it what you really need? There are considerations like, does it fit through the doors in your home in the way you want it to? Do you have ramps to get it in and out of your home? Are you going to transport it? Are you going to put it in a van or put it on a lift on the back of your car? So all of these things are considerations that a seating clinic is going to help you work through. So those are some of the things that physical therapy is going to work with. What about occupational therapy? In the broadest sense, when we think about what occupational therapists do, we think of activities of daily living. So they tend to work with things that involve dexterity, writing, using a utensil, keyboarding, but really anything that involves just how you carry about your daily activities. They might work with you, say, on adaptive cooking. One of the things that we have here through our rehab program is an adaptive kitchen. We can have someone sort of go in and see how their kitchen could be set up to really work around any physical challenges that they might have. Occupational therapists, again, wear a lot of different hats. They may work with energy conservation. So there is a tendency in some people with MS who are dealing with fatigue to say, okay, I'm having a good day, and on this good day, I'm going to cram 3 days worth of activity into this one good day. And unfortunately, then they're out of commission for the next 3 days. So they tend to come in two speeds, 100 miles an hour and wiped out. What energy conservation does is try to help people work with strategies to kind of spread those tasks out and do things in a little smarter way rather than spinning your wheels all in one short period of time. Speech language pathology. Again, these therapists wear a lot of different hats in the MS world. They may work with speech issues, just like their name would suggest. So one of the more common things we see in MS is word finding difficulty. You're cruising along in conversation and all of a sudden you hit this verbal speed bump. I know the word's in there, but I can't think of it. Maybe 5 minutes later, it pops into your head. So the speech language pathologist may work with you on that. They may work with you on the motor parts of speech. So if you're having slurred speech, they may help you work with that. They also work with speech volume. When we think about fatigue with MS, some people have motor fatigue. They say they walk at a certain speed, but the longer they go, the slower they're getting or the more difficulty they're having walking. Well, that can happen with speech also. Some people with MS get something called hypophonia. Their voice gets quieter or hoarser as they use it more. So maybe late in the day, they're having a hard time being understood because their voice gets so very quiet. That's one of the things that a speech language pathologist can work with in the MS world. Swallowing issues, another thing that people with MS in speech language pathology work with. We take swallowing issues very seriously. If you say you're having swallowing issues, I believe you, and I'm going to probably refer you to a speech language pathologist, because sometimes what you report to us and then what we see objectively, the problem may be bigger than what you're even aware of. And one of the things we don't want to see with swallowing issues is aspiration. We don't want to see food, liquids, even your own saliva going down the wrong way, because that could put you at risk for pneumonia. So when we send you to the speech language pathologist for swallowing issues or dysphagia, they're going to take a history, and they're probably going to do something called a modified barium swallow. That's the way they evaluate how well you're swallowing and where any problems might be. If you think about swallowing, it's a very complex, multi-step process. A lot of things have to happen in just the right sequence for swallowing to be normal. It's not too much of a stretch to see how multiple sclerosis could throw some sort of problem into that multi-step process to make that swallowing maybe difficult for you. So modified barium swallow is something that we can pretty much expect if we send you to the speech language pathologist for issues with swallowing that you might report. One of the other hats that speech language pathologists wear is cognition. So speech language pathologists may participate in cognitive rehabilitation. Depending upon the setting that you're in, usually that falls under speech language pathology. In some places it may fall under occupational therapy. So if you report cognitive issues to us, we have a couple of different tools in our toolbox to think about, or referrals that we can make. So we may refer you to a neuropsychologist to do the more extensive testing. I always warn people when we refer you for full-scale neuropsychological testing, it is an all-day affair. There's a standardized battery of tests that are done, and it's usually going to take several hours. You're going to come out exhausted. I always compare it to taking a college exam that you didn't prepare for. That's normal. It is designed to push you to failure. So after you sit down with a psychometrist and do that testing, the neuropsychologist takes all that data, puts it together, and sort of collates a multi-page report and sits down with you and goes over what the findings were and where the highs and lows are. When do we think about that referral? Definitely if there are vocational issues. So if you say you're struggling at work, you're thinking about changing jobs, leaving a disability, we probably want that neuropsychological testing to help you make an informed decision. So shifting back to the speech language pathologist and the role that they may play in cognitive issues. So they may work with cognitive rehabilitation. So they may take the data that the neuropsychologist has gathered and use that to help design a plan, or they may do testing on their own independently from the neuropsychologist. Typically, the testing that the speech language pathologist is going to do is much briefer. It's going to be very focused. They'll do a few battery of tests and kind of get a sense of the highs and lows. They're going to really focus on how you function. They want to design strategies to help you function better. Very hands-on, very practical. Cognitive rehabilitation is something that we do refer to quite frequently with speech language pathologists in the MS world. So those are kind of the different roles that these different types of therapists play, along with the formal therapists. In many rehab facilities like ours, you may have exercise physiologists. So these are people who work alongside the therapist. You may have physical therapy techs. So these are, I think I would compare them to like a medical assistant. So if a physical therapist is maybe working with 2 or 3 individuals at the same time, they're stepping back and overseeing. They may have the technicians going in and doing some of the hands-on stuff to sort of help them be as efficient as possible. There are all kinds of pieces of equipment when you go to the therapy facility. Looking at some of the more specialized things that are out there, we talked about the vibration plates. One of the other types of pieces of equipment are things that might help unweight you. So if you have difficulty walking and we think that maybe you would benefit from having some of your body weight taken away, one way of doing that would be with an aquatics program. So if we put you into a pool setting, some of you're floating, some of your body weight is removed. It's going to be a low impact exercise. So aquatics programs can be wonderful for people with various physical challenges. One of the questions that comes up frequently with aquatics is pool temperature. We know that many people with MS have heat sensitivity. We would be leery of putting you in a hot tub. About 70% of people with MS have heat sensitivity. A couple of points about heat sensitivity. It's not dangerous. If you do get into an aquatic situation that's a little too warm for you, you are not causing permanent damage. You're probably going to feel weaker, tireder, maybe legs are a little noodly, but it's going to go away as soon as you cool off. So it's okay to try to maybe push that envelope and test things to see if a given pool is appropriate for you. If we look at the official approved sort of pool temperature for aquatics programs in MS, it's said to be 85 degrees Fahrenheit. One of the questions that I had years ago is, where did that number come from? It turns out that that number is based on very, very small studies from decades ago. So I think 85 degrees might be ideal for some people, but I think it's certainly okay to try pool temperatures that are warmer than that. Not everyone with MS has heat sensitivity. There are some people who can tolerate a 95-degree pool. So again, be flexible in trying out these different programs. What are the other ways that we might sort of take some of your body weight away to let you try different forms of exercise? There's a piece of equipment called an AlterG. This is a treadmill in a sort of an enclosed capsule. So you get in, and from the waist down, you're in this enclosed capsule, and they can set the machine to actually take 80% of your body weight away. So it's like you're kind of walking or running on the moon. Kind of neat way of getting some of the body weight away. One of the limitations of that piece of equipment is that the therapist cannot touch your legs when you're in that sort of enclosed capsule. Therapists love to adjust and sort of help you get proper movement, so that is a limitation of the AlterG. Another way that we can sort of take some of your body weight away is with a piece of equipment called the Zero-G. This is a track system that goes along the ceiling in the rehab facility, and there's a sort of harness. So they put you in this harness. They can take some of your body weight away, maybe a little bit, maybe a lot of it, so you can actually walk around the facility on that track system in an unweighted manner. Sometimes they'll park your sort of halter system that you're suspended in right in front of a treadmill, so they're actually letting you do a treadmill in that unweighted setting. And they can still touch your legs and sort of manipulate and show you proper movements while you're in that Zero-G setting. Again, lots of different pieces of equipment that are out there. Along the lines of equipment, there is something that just got FDA approval late last year, early this year, that you may see in certain therapy settings. It's called the PONS Neural Stimulator, PONS Neural Stimulator, from a company called Helius, Helius. And what this piece of equipment speaks to is the concept of neural plasticity. We hope someday to be able to repair damage in the brain and spinal cord in people with MS and other neurological conditions. If we can't repair it, what if we could just reroute? What if we could form new pathways and sort of reroute around areas of damage? This is called neural plasticity. So what the PONS neural stimulator looks like is a little headset, but you don't wear it up here. You hang it around your neck. There's a little wire that comes off, ends in a gold-plated electrode that sits on top of the tongue. It's only used during aggressive rehabilitation. In studies, what they've seen is if you take groups of people with MS who have walking issues, both groups get aggressive rehabilitation. This group doesn't wear the device, this group does wear the device. Both groups get benefit. The group with the device got more benefit, and it was longer lasting. The challenge is when I say aggressive rehabilitation with a device, the way the program is set up right now is you would come into a facility and work with a therapist at least 3 times a week for 2 hours per session for 3 months. On the days you're not doing that therapy, you're going to be doing aggressive exercise at home with the therapist touching bases with you by tele-rehab. So it's a pretty intense program. What Helius hopes to do is train physical therapists in different communities so that they would be familiar in working with this device. So very exciting that we're seeing new technologies develop. They're going to help people with MS function more effectively. One other setting that I will mention for receiving therapy would be in the inpatient setting. This is rare that this comes up, but it does happen. If you have a severe MS relapse and you have a significant decline in your level of functioning, maybe you're hospitalized for that. Maybe you're hospitalized for IV steroids, IVIG, plasma exchange. After that acute hospitalization, it is possible that you may go to a rehab facility inpatient to get very aggressive rehabilitation. Again, unusual that happens, but it does come up from time to time. One of the programs that I just want to let people know about that we have here, that I'm hoping we see sort of duplicated in other places, is called the ITP program, Integrated Therapy Program. What that does is it takes all of those benefits that you would get in an inpatient setting, but you're still technically outpatient. So this is going to be a very comprehensive team that's going to work with you, all of the different therapy modalities, working with you for several hours per day. This has evolved in our center over the years, and what we currently do is you're going to work for 1 week with this intensive team. You're going to then go home for a week. So when you're here, we mentioned that it's outpatient. If you live close enough to our facility, you can certainly drive back and forth every day, but Atlanta traffic is not fun and many people don't live close enough to do this. So in the floors above me here, it's a residential facility. So we have apartments that with donor funds, we can actually cover the cost of the person with MS staying on site. So they come in, they work with this comprehensive team, they go back upstairs, they hang out, they're not battling Atlanta traffic each day, they're putting all of their energy towards getting better rather than fighting with traffic. So 1 week here, go home for 1 week. Try out all these things that you've learned, touch bases with a therapist by tele-rehab, and then come back for another week to fine-tune all of the things that you've just learned. We have consistently seen that this is of great benefit for people who have a lot of different rehab needs. Again, ideally you would have multiple rehab needs, PT, OT, speech language pathology, that you would really benefit from this very intensive approach. The therapy modality that I will finish up with is, again, a more specialized type of therapy, and that's called hippotherapy. Hippo is Greek for horse. Hippotherapy is physical therapy on horseback. So there are physical therapists who have done this specialized training in hippotherapy. If you can identify one of these facilities in your area, the beauty of it is insurance will cover it as if it's physical therapy. There's another level of horseback therapy, if you will, called therapeutic riding. A little bit different, still could be of significant benefit, but these are not physical therapists. These are usually people who are very knowledgeable with horses. They have some knowledge about the various health conditions that might benefit, but it's a different level. If you go to a true hippotherapy program, the thing that always amazes me is that they really can accommodate almost any level of functioning. They have ramps, they have Hoyer lifts. I have seen people in power chairs participate in hippotherapy in a very safe and effective way. One of the advantages of hippotherapy, and if you think about what it does, is you're forced to sit on horseback. You're using all of these core muscles. You're balancing with that horse. When the horse is walking, your pelvis is moving with that horse just as if you're walking. We typically see significant improvements in core strength. We see improvements in balance, if that's an issue. And again, it's kind of, I think one of the things that makes it unique too is it's fun. It's an adventure. A lot of times when you come to physical therapy, people think that, oh man, I'm going in, I'm working. This is hard work. They're really pushing me. Where sometimes hippotherapy feels more like a fun outing where you're still getting significant benefit from it. So I feel very passionate about all of these forms of therapy. I'm a little biased. I work at a rehab hospital, so I think that these things are very important. When you look at where research is headed in multiple sclerosis, we've gone from having no FDA-approved disease-modifying therapies to now having nearly 30 when you count the generics and biosimilars. And those things are very exciting. That's immunology. That's high science that is making a difference in people's lives. While we're doing that, we don't want to ignore things that can help you also, like these various therapies. So we want, again, to have all of this stuff put together so that you can lead your best life.
Thank you very much. Thank you. And that was awesome. I don't know how people would not be paying attention to everything that you were talking about. That was like beyond beautiful. And even beyond beautiful because, again, even when we were video recording, I was saying to you over and over again, I don't know how you do this without any notes. And you just sat there and you spoke so fluidly. It was great. So we are here with Dr. Thrower, and tonight's program is part of our series. This was part 3 of 4 of learning more about multiple sclerosis. And we had Dr. Thrower video record several programs, and he's here now to take any questions you might have. So for anybody that has questions, now's the time to write. There you go. Any questions? You got to have questions about what he just spoke about, so that way we could ask your questions. But one of the ones I want to ask about is when people are having physical issues and they're compensating for their legs, and they find that their legs are no longer walking straight, but now their legs have separated, like me. I mean, you know about the issue that I'm having, right? And I feel like I'm walking like a duck these days. So when people say, what's wrong with the way you're walking, I quack at them, all right? But what is done to turn those feet back in again? I know others that are going through similar situations.
So I think there are two things that can do that with MS. So some people are putting their feet further apart to compensate for loss of balance. So if you have what we call sensory ataxia, or that loss of position sense, and you're at risk for falling, one of the ways of making yourself more stable is just to give yourself a bigger base by putting your feet further apart. And then sometimes with spasticity or increased tone in the legs, people will tend to, sometimes the feet may go the direction they don't want to go. We see some people that actually toe in, some people toe out. So it's usually one of those two things, the loss of proprioception or the spasticity. And that's one of the areas physical therapists are wonderful at helping with. On the spasticity front, I always tell folks, we have the drugs that we can make your legs looser. The question is, in making your legs looser, do we make you sedated? Do we actually make you too noodly? Now your legs are too rubbery. And do we actually impair your walking by making you too loose, by pushing too hard with medicine? So I would much rather manage someone's tightness in their legs through therapy and stretching than by throwing drugs at them if we can. Sometimes we have to do both.
All right, next thing, the vibration plate. I got on it when after you spoke about it. And that thing is super strong. You say that it could be used for people with osteoporosis. Might it actually crack a bone if they have osteo quite badly?
So if someone has osteoporosis and they've not stood up, let's say someone's been in a scooter, power chair, or manual wheelchair for a long period of time, there is a potential safety concern. So if someone has not been weight bearing on their legs, we want to be thoughtful in who we stand up, period, not let alone put them on the vibration plate. So if someone has been weight bearing to some degree, standing, transferring, those people, even if then they have bone density issues, those people are probably safe to get on the vibration plate. The beauty of it is as you saw, is you don't have to do anything. You just have to stand there. We do tell people you want to clench your teeth. If you don't clench your teeth, if you have your teeth a little bit apart, it will rattle your fillings out of your teeth.
Sure.
So yeah, and again, it's easy of an exercise as you can humanly get. A lot of facilities, health clubs, physical therapists, occasionally we'll have someone who likes these things so much they'll buy one for their own home. I think it's a cool kind of a technology.
Sure, thanks for that. And also with the vibration plate, is it adjustable or is it just one speed?
The one that we have is kind of a one size fits all. There may be other units that kind of you can tone it down a little bit, but the whole purpose is to really get that oscillation. So we think of it in terms of helping bone density. The thought with helping your balance is that even though you feel like you're not exercising, when that thing is vibrating, you're actually having to make little micro adjustments in your balance to sort of keep up with it. So it is helping core strength.
Right. But you can mix a shake while you're on there.
You could indeed.
Right. Gotcha.
Multitask.
Yeah, exactly. All right. Next, we have a person online that says that she got in a little bit late. She would like you to please explain about the speed bumps again.
So these are the verbal speed bumps. So if you had to say what are the two most common cognitive issues that people with MS deal with, it's probably word finding difficulty and slowed processing speed. So word finding difficulty You're in conversation, there's a word you've used a million times, and now you can't think of that word. And so to you, it feels like, I'm cruising along at 55 miles an hour, and now I've hit the speed bump, and everyone around me knows that I can't find the right word. Please know that the casual listener is probably nowhere near as aware of that issue as you are. People with MS really beat themselves up over this. And we do take it seriously, but the frustrating thing about word finding difficulty is the more anxious you get, the more likely it is that you're going to have more word finding difficulty. So that's the speed bump, the verbal speed bump that we think of. The good news is that all of the vocabulary that you've learned over the years is still in there. It's just that with MS, you may not be able to pull it at exactly the right time. I date myself when I'm in the exam room. I tell patients, it's all in the Rolodex. And I say Rolodex to the 25-year-old person. And they're like, what the heck is a Rolodex? So I have to come up with new terms to describe the fact that stuff is in there. You just may not be able to pull it when you want. That is something, again, that the speech language pathologist can help you work with.
Fabulous. Isn't there, I've had people when I've had professionals when they realize that I'm looking for a word like I was just looking for, say, always keep in your mind to look for another word that's similar. And sometimes that one just comes out of your mouth a lot easier than the first word that you wanted to say that you can't say. So do you all practice that as well?
Sure. So that's one of the strategies that people can use is so they're thinking of canine and they can't say canine, so they substitute dog. Or the other thing they'll do is they'll sort of talk around the concept. They'll say they're thinking of mop and they'll say, I can't think of mop. Well, that thing that I clean the floor with, the strings on the bottom. So there are a lot of different strategies, and then typically a few seconds later, that word's going to pop into your head, and you've gotten past the speed bump.
Great, thank you for that. Next person has a question. How often do you recommend having physical therapy? Like once a week, once a month, 3 times a month?
So in a perfect world, I would have everyone with MS touch bases with a physical therapist every year, just as kind of a tune-up to make sure that things are going well. We don't live in a perfect world. We live in a world that is, to a certain degree, as far as our healthcare, is dictated by health insurance companies. And so all of us with our health insurance plans have different benefit packages. And so some insurance plans will allow for a lot of therapy and some a little bit of therapy. So when I, as a neurologist, send you to a therapist, I kind of write them a blank check. I say, you work with this individual and you guys come up with a plan and figure out what's going to be best. And then we see what insurance is going to actually let us do. One of the frustrations with insurance is that they will only cover therapy until you've reached maximum sustained benefit. That means, okay, I've gotten as good as I'm going to get with that session of therapy. Well, we would like to maintain that therapy. And when you think about your disease-modifying therapies in MS, those disease-modifying therapies are designed to keep you from getting worse. Well, we think of therapy in the same way, but unfortunately, insurance companies don't look at it that way. They will only cover therapy as long as you're getting better. So that in one of our second program, we talked about wellness programs. And so that's where wellness programs come into play. We can't do physical therapy forever. So we would like for then after therapy to roll you into some kind of sustainable exercise program that would let you continue these benefits indefinitely.
Okay, thank you. Next one writes, will the vibration plate help with leg spasticity?
Typically not. So I wouldn't think of vibration plates as something that we're going to use for spasticity. So where therapists are going to help with spasticity is with range of motion, really trying to work with you on sort of getting into a good stretching program at home. If you have extreme spasticity and maybe you've actually developed contractures or where the tendons have actually tightened in a joint, one of the things that therapists can do is something called serial casting, where they actually put that joint into a fixed position. So they're trying to flex it or extend it depending upon the need. And then after a while, they're going to kind of recast it. So they're just stretching over weeks and weeks to try to get some range of motion back into that joint. Another form of stretching that is out there that we should probably mention is something called dynamic stretching. Typically, when a physical therapist or you're stretching at home, when you stretch a joint, you put that joint into a certain position. I'm gonna, sort of work on my calf muscles. So I bring my foot up and I hold it there for a couple of minutes in that sort of stretched position. That's called static stretching. So I'm holding it in a set position. Dynamic stretching means stretching the joint through active range of motion. And so there are facilities out there that can do dynamic stretching for people with MS. These are usually private franchises, something like the Stretch Zone or Orange Theory, the exercise facility does dynamic stretching. I think Massage Envy does it also. So typically not covered by insurance. You go there, you pay a certain amount of money. It's usually not expensive, and that team is going to work with you for 30 minutes or so through this different form of stretching.
Gotcha. Thank you for that. Next person writes, I'm not ambulatory, but stand to use the facilities. My left knee has turned inward, which makes things harder. Which professional should I seek?
Yeah, so that's going to be physical therapy. So really anything, pretty much from the waist down is going to be physical therapy, and they're going to work with you, on that range of motion, on potentially strengthening. Sometimes with the knees are funny with MS. Some people hyperextend their knees as a form of compensation to compensate for weakness. Some people are hyperextending their knees as a form of spasticity. Sometimes the physical therapist, to help work with some of those knee issues, may think about bracing for the knee. They may get an orthopedic surgeon involved for their 2 cents worth. So that's going to be a physical therapy issue.
Gotcha. Thank you. Next, can anybody with MS have access to the full range of PTOT speech services offered at your center without actually seeing a doctor at your center?
That is a wonderful question, and that the answer is absolutely yes. So I think of Shepherd Center as a community service. So we do have outside neurologists who refer their individuals with MS into our facility to work with the therapy team, and we as the neurologist never see them. That person is completely happy with their neurologist. They just need to access really good rehabilitation, and that is absolutely okay.
That's great, thank you. What do you all do about severe spasticity or tightness to like an IT band, all right, from after an injury? Do you do any massage therapy as well? I mean, for instance, about my leg, all right? So everybody, I've had a broken leg since June, all right? It's really been screwed up. The side of my body is one side compensating for the other cause ripped tendons on the other side. Well, now we're at the point where I can't lay left or right, and so they're doing a very intensive, hard gun massager to my bands, all right? And let me tell you, the whole place knew today, the physical therapy center knew that this guy was drilling it into me, and it hurt like hell, but it released after just 10 seconds, and it felt great. Do you do something like that over there as well?
Absolutely. So we don't call them physical terrorists for nothing. So that, no pain, no gain. So the IT band or the iliotibial band kind of runs on the outside of your leg down to from the hip down to the lower leg. And when it's tight, gives us all kinds of different issues, range from hip pain to tightness in the lower leg. So the physical therapist, in their toolbox, they have their stretching, they have massage therapy. You may have been talking about that little thumper device that sort of helps loosen some of the muscles up. Dry needling may play a role for some people, and some physical therapists are trained in that. What the physical therapists are also great at is getting back to the rest of the comprehensive team, and sometimes coming to the providers and saying, listen, we've tried everything, and we think we need to up our game. So we may refer them across the hall to our physical medicine and rehab docs for things like Botox injections. So that's the beauty, I think, of a comprehensive MS center is that each team member knows their role, and they know when, okay, I've exhausted my options. Now it's time to move on to someone else on the team.
Okay, thank you about that. Now let's talk about core strength. We're talking about core therapy. How do they know? Obviously, they're professionals, but how do they know how much pressure to push on somebody for core therapy, using the pole or otherwise to get somebody to push back against it, raising the pelvis or et cetera?
Yeah, I mean, with anything in therapy, there is clearly no one size fits all. And that's the beauty of working with therapists who have experience in MS is they kind of know how to listen to what the person's saying. Again, like you experienced with your IT band therapy, it hurt when you first started it, but once you got through it, there was great benefit. So that's something that experienced therapists know how to kind of do is how much pain is okay, how much is not okay, when do we need to back off and try another modality? And again, realizing that there is no one set recipe that's going to fit everyone with MS. You want to try out different things and be pragmatic, adapt as the person's needs dictate.
Sure, thank you. All right, person is asking, how can I find a PT specifically for multiple sclerosis?
So sometimes it's word of mouth. So through your local support groups, you may talk to people who say, hey, I've worked with this therapist and they're very knowledgeable. They did a great job. You may have therapists that come to your support groups or to, do talks at different things. So with the National MS Society, you do have a function called navigators. So if you call the 1-800 number for the National MS Society, they can plug you into these navigators. And so they should be able to give you a referral list for therapists in your area that have some knowledge and expertise in working with multiple sclerosis.
Thank you. And a question is, can you describe again the swallowing test?
Yeah. So if you come in and you say that you are choking on food, liquids, your own saliva, again, we're going to take that very seriously. My threshold for referring you to a swallowing therapist is about that much. So once you see the swallowing therapist, they're going to take a history. There is a good chance they're going to do this test called a modified barium swallow. It's not horrible. They're going to have you drink a flavored dye while you are standing in front of live x-ray. They're going to sort of film how that dye moves from your mouth to the back of your throat, down into the esophagus, and make sure that everything is happening in the appropriate sort of sequence. The swallowing therapists are wonderful at identifying where it is that your problem is at. Most swallowing therapists have referral sources. So if they think, part of your problem may not be your MS. Surprisingly, we see a lot of people with really bad reflux that can then complicate their swallowing issues with MS. So a lot of swallowing therapists work closely with gastroenterologists who can address that sort of reflux end of things. So that's what the modified barium swallow is. It's just a live x-ray using a flavored dye to see how you're swallowing.
Okay, thank you. When a person is getting physical therapy, they get a baseline start. And how often is somebody reevaluated for what they're doing?
So if we refer you, say, for walking issues, your initial session of therapy is going to be anywhere from once per week to 3 times per week, depending upon your needs and transportation and just practicalities. And it's going to go on over a set period of time, maybe 4 weeks, 6 weeks, 8 weeks. It really depends upon how you're progressing and what your needs are. So at some point, that physical therapy sort of referral ends. You've gotten all the benefit you're going to get from that session. Maybe your needs change 6 months later. We may refer you back to physical therapy for another round because your needs changed. That's where that insurance end of things comes into play. We may have used up, say, all of your benefits for a given year with a physical therapy session, and sadly sometimes we have to wait until January 1st of the next year when your insurance kind of rolls over again to start another physical therapy session. So it really does vary tremendously from individual to individual.
Okay, thank you. We did all that work at your center for different forms of therapy, and we forgot something very, very important: aqua therapy.
I think we mentioned it briefly, the aquatics therapy.
Okay, you mentioned it briefly. Tell people the benefits of, if you mentioned it briefly, you might have even mentioned that. I might have missed that. But if you can again talk about the benefits of aqua therapy as opposed to even just walking.
So I'm a big believer in aquatics therapy. We're at Shepherd Center. We're blessed. We have this ginormous swimming pool. It is temperature regulated as much as you can in that large of a body of water. So with aquatics therapy, the benefit of that is you are taking the person's body weight away. If you have balance issues, if you have weakness, and you really can't weight bear, or you're high risk for falling, well, what better situation could there be than to put you into a safe, controlled aquatic situation where we've taken some of your body weight away. You can't fall, you're in the water. And so working with a physical therapist, one-on-one in that pool situation. Sometimes there are aquatics classes that are done also. So you may be more of a trainer or an exercise physiologist who's running those classes. So again, I think the major benefit is taking the body weight away. If we have a pool temperature that is on the cooler side, what that may also help eliminate is heat sensitivity. So 70% of people with MS do have heat sensitivity. If I put you on a treadmill and I exercise you and your core body temperature goes up, well, now you've developed a foot drop, or you have some other symptom that acts up due to heat sensitivity. Well, if I have you in 85-degree pool water that's cooler, that's helping dissipate some of that body heat. So you're eliminating some of the heat sensitivity and exertional symptoms that we see come on in people with MS. Look at, if someone's interested in aquatics therapy, you can certainly talk to your healthcare team, see if it's something if they have a referral source for you. Look at your local resources like exercise facilities, the YMCA. Let's say the YMCA has a pool, but you check out the pool temperature and it's 92 degrees, and all of the MS literature says 85 degrees is perfect. Don't be afraid to try it out. You may find that even though 85-degree Fahrenheit pool temperature is ideal, you may tolerate 92 degrees. How do I know if that pool temperature is too warm for me? If I get in the pool and then when I try to get out, if I'm just exhausted and my legs are rubbery and I just feel not quite right, that pool temperature was maybe a little bit on the too warm side for you. Please know that if you do expose yourself to a pool temperature that's a little too warm, you're not hurting anything. You're not causing new demyelination. You're not going to cause a relapse. That's purely an electrical phenomenon. You've just drained the battery in your brain or spinal cord for that one short period of time, and you'll bounce right back once you cool off and rest and relax.
About the aquatherapy. So what if you all want to do aquatherapy on somebody because you feel that it is greatly needed and that person is afraid or cannot swim?
So most aquatics programs, you're not actually in over your head. So you don't really need to know how to swim to do an aquatics program. Usually you're in, at most, chest deep water. So the lack of swimming ability, not a problem whatsoever. It's interesting when in the aquatics programs I've worked with, we hear that as a reservation for why people don't want to go. And the other reservation we hear is, I don't want to be in a bathing suit in front of people. There are no supermodels in most of the aquatics programs. We all have our own little carrying around maybe a little extra weight. So please don't let that be a limitation to you participating in aquatics. This is not a fashion show.
Okay, thank you. So we are out of questions, and we're going to call it a wrap for the night. You get to go home and take it easy, and we get to go back to doing more work for the night. Okay. All right. Well, thank you again for everybody being online tonight. And Dr. Thrower, thank you very much for being part of this series. And we greatly appreciate what you've done. And I'm going to say good night. Good night, everybody.
Bye, everybody. Thank you.